Are you someone who, if you were stopped in the street and asked, "Are you healthy?" you would say yes? If you were pressed for to give reasons why you think you're healthy, you would probably say, "Because I feel great and have no complaints." Well, if we pressed further, would you say, "Okay, well, if we're nitpicking, then I have a little reflux, or I'd like to lose a little weight, or I don't sleep that great when I think about it"? If that's you, then you fit in with many other Americans who feel great or what they think is great, and so they would say they don't have any health issues. But I want to ask you, what if how you feel is not actually great? What if it's just the best you've ever felt? But what if you've never felt good? How do you define good? And how do you know if you're actually healthy or not? We want to use objective indicators by looking under your hood to see, would your blood work say you're as healthy as you say you are? And so oftentimes the blood work wouldn't. And so we don't want to fall into the trap of feeling equals function. In actuality, feeling does not equal function. Function equals function. And we want to measure function by using objective lab tests. I want to share a case with you today of someone who said they felt great and didn't really have any complaints other than a little reflux. But when we look under their hood, we see that things weren't so great. And then we see when they took action, how quickly they actually felt amazing and how they realized what they thought was good in the past was nowhere near the amazing they feel now. I'm Dr. John Bartemus, and I'm putting the pieces together to help you live a life at optimal. All right, so here we are with the patient's labs, and these labs are from a patient, as I said, of someone who in general felt good. And if you quiz them, they would say, "I feel good." And then if you pushed a little, they'd say, "Well, I have reflux after meals, especially with spicy food. But other than that, I'm okay." If you ask them, "Are you on any medications?" they'd say, "Well, I have high blood pressure medications. My doctors want me on statins, but I'm not." So that's the background, and that's a background that would be very common if I just went out in the public and asked people, "Hey, are you healthy or not?" They'd at first say, "Yeah," and then if you press them, maybe they'd say a few complaints, but they'd say, "If I don't eat the spicy food in general, I feel good, therefore I think I'm healthy." Well, if we tested those people, they probably wouldn't be. There's probably um, some margin that they could gain in their health, which would also result in big time gain in their quality of life, their experience, get them to truly feel well. So when we look at this person's labs, you can see that the cholesterol panel is one that would definitely scream statin drug in the conventional medical model. One thing you want to observe here is that the triglycerides are quite high, and as triglycerides approximate total cholesterol, we start to question, does this person have insulin resistance or metabolic syndrome or some sort of blood sugar dysregulation? If so, we really want to address that, because that's not only poor in terms of setting them at risk for type 2 diabetes, it's also going to contribute to uh, potential hypertension and potential systemic inflammation that leads to a bunch of other issues. So this person was aware that they had hyperlipidemia, and um, so that wasn't news to them, but it was news to them as regards to what I just discussed about the triglycerides and cholesterol. C-reactive protein is functionally elevated, meaning it's not lab high as regards to what the medical doctor would say, but in terms of a low-level chronic, like burning ember inflammation, this is higher than I want to see. As we scroll down, this person has um, mucosal immune dysregulation. Their antibodies, their IgA antibodies are lab high. IgA antibodies occur anywhere you have mucus. So sinuses, gut, lungs, bladder, anywhere that your body is exposed to the outside world will produce mucus in hopes to stop the pollen or the gluten or the virus or the bacteria that first enters the body. And IgA is the first defense by the immune system. Grab that, chelate it, and get rid of it. So seeing lab high levels here tell us that this person is under high assault from environmental type antigens. And, and as we scroll down here, you'll see right here, lab high thyroglobulin antibodies and thyroid peroxidase antibodies. Sorry about that. So with lab high numbers, those are massively high numbers. You'll see thyroglobulin should be less than 1, that's 570. Thyroid peroxidase should be less than 9, that's greater than 900. So they're no longer measuring once they've gone above. These are the antibodies that attack the thyroid gland and are the autoimmune process that is involved in Hashimoto's disease. So having antibodies this high shows us that this person's immune system has lost self-tolerance, or essentially it no longer tells the difference between you and not you. So it's attacking this person's thyroid at a high rate. And if you don't get this under control, that could drive hypothyroidism, unhealthy hair, skin, nails, and ability to lose weight, brain fog, depression, constipation, all kinds of symptomatology. As we keep going here, this person shows a viral infection that they were not aware of, but it shows that their immune system is mounting a response to a viral infection. And so the take home here is you can have subclinical infections going on that are not driving your white count sky high and not causing viral cold, viral infection type symptoms. So again, this can be happening below the surface. You may feel well, but you're not functioning well. Your immune system is dealing with something that is going on beneath the surface. And other immune, I'm not going to dive into it deeply here, but his white blood cell differential also shows an imbalance in the immune system that is pro-allergy, pro-histamine, pro-sinusitis, that sort of thing. So when that imbalance is there, you're going to be weepy. You're going to have mucosal immune issues, and we saw his IgAs were lab high. And down here we can see ferritin is lab high. Ferritin is a marker of potential marker, is the best marker of stored iron status, but it is also a marker of inflammation. So you have to be able to tease out which is which here. And in this person, it is a big time marker of inflammation. High amounts of systemic inflammation. We've seen a couple markers already in this person. Creates immune dysfunction, can lead to chronic disease and autoimmunity. The last thing we want to look at is this person's vitamin D is lab low. So I'm sure you know vitamin D is involved in bone health. Vitamin D is a Swiss Army knife. Vitamin D is big time important as an anti-inflammatory, very important in mobilizing your immune system against infection. So we saw there was the subclinical viral infection going on. We have lab low D. That's going to be a piece of that picture. The lab low D, we're lacking the anti-inflammatory benefit. We've seen multiple markers of inflammation or pro-inflammatory markers. So what we can take home is this person feels great, but are they functioning great? I'm sorry, I'd say great by the way they would define it, but have they ever felt great if this is what they look like underneath? Probably not. Well, now let's fast forward. Now we're going to look at midway through care, 6 weeks into care. We'll ask this person through a progress report, how are you doing? What have you noticed? How are you feeling? Does your feeling match your function? So let's switch over to that. So here we are 6 weeks into care with this person's progress report. And what I do is I take them through multiple questions, questioning different areas and quality of life to see are they 0% better, 25%, 50%, 75%, 100% better. So as we go, you'll see the improvements this person has experienced by following an individualized specific action plan that I created for this person to address things we saw on that blood work and other testing that we did that we haven't gone over. So, first question, anxiety and depression, how is that? That doesn't apply to this person's case, so we skipped it. Fatigue levels in 6 weeks, this person exhibited 75% improvement in fatigue or energy levels. Fatigue was not even a complaint for this person. This person, remember, said they felt fine, or if you translate it in regards to energy levels, when you ask them that, they would have said, my energy levels are fine. Well, after 6 weeks of care and optimizing what we found, this person now says their energy is 75% better. So they've reached a quality of life from an energy standpoint that they didn't even know existed. That's awesome. Digestive problems, gas, bloating, constipation, reflux, specifically in this person, 100% improvement. And you'll see they wrote heartburn gone completely, even with spicy food. So previously, if they ate spicy food, it would drive their reflux. Now they can eat spicy food and they don't even have reflux. Huge. Brain fog, mental clarity, 75% improvement. Again, if you quiz them earlier and said, how do you feel? I feel great. They thought feeling equaled function. We found that function was off, so feeling didn't equal function. We're optimizing function, and now they're functioning and feeling better. Brain fog, which they didn't even mention before, 75% better. So their cognitive function, their clarity, their executive function is at a level that they didn't even know existed 6 weeks ago. Chronic pain, numbness, tingling, 100% better. Quote, unbelievable difference, no joint or tendon pain. Hair, skin, and nails, 75% improvement. Person's growing more hair. Sleep quality, 100% improvement. No more snoring. Incredibly deep sleep. How many of you would kill for incredibly deep sleep? How many spouses out there would kill for their spouse to stop snoring? Raise your hand. My spouse is. So again, this wasn't a complaint entering care. The person mentioned that they snore but didn't think that could improve. Now they're no longer snoring, getting deeper sleep, and their spouse is very happy. Attitude, outlook on life, 75% improvement. Can't wait for the next 6 weeks. So they've acknowledged the massive they've created by addressing what was suboptimal underneath, by addressing the function that was off, even though they couldn't feel it, and their life has been totally changed. So if this is you, if you're someone who has said, I feel fine, why would I need care, but you've never truly looked under the hood to see if your function matches your feeling, then this may be a good time to do it, and functional medicine practitioners are trained to help do that for you. We are the CSI health agents that, even though you feel great, we want to go underneath the hood and say, are you functioning great to match your feeling? If you're not, let's optimize your function, create new levels of feeling for you that you never knew